My name is Richard Areba. This is my channel, and I'm back here again today to make this video and share these kind of experiences. So, just a platform that I call the Global Nurse Impact. This is where we share stories and innovations around healthcare, and also just because I moved from Kenya to the US, I'm trying to share experiences because I really worked in different uh, healthcare companies in Kenya, including government, and I've seen how healthcare is given in Kenya, and then now trying to give an overview about the big differences that I've seen healthcare in the US, what they're doing differently, and of course maybe get to look at the best practices and what exactly they're doing differently, and then mimic or copy and try to improve what we already have. So most of the time when I speak about healthcare, remember, I am only referring to the 95% of people. 95% of Kenyans access healthcare in government hospitals, public hospitals. 95%, more than 95% of people. So these are the majority. And most of the time, those are the facilities that I've worked for a long time in different positions. I've worked as a registered nurse, staff nurse. I've worked as a charge nurse in a medical facility, government facility that offers services to people in within Nairobi, Kenya. And so when I give my own overview or experience, I'm only referring to healthcare in terms of what the government is giving. The difference that the government is providing services to individuals at that level, that is exactly what I'm trying to compare and contrast between the experiences that I've had in Kenya and now in the US, and trying to look at what can be the best practices. We call this government sends people from different countries to developed countries like Japan, US, Australia, UK, to benchmark, to go and see what these people are doing differently. Now, in this particular case, I'm offering myself to openly share these experiences in my channel. This is Richard Ogachi. This is my channel. I ask that you subscribe, hit the subscribe button, and let's keep building this. So one of the marked observation that I've seen healthcare in the US is when patients are being diagnosed with diseases or whatever infirmities, what they are suffering from, the first contact is when patients get to the hospital in the US, they first of all are treated. You get treated, and then they send the bill home, which is exact opposite of the Kenyan situation. What we have in Kenya is you get to pay first to access, and that's one of the downsides. You see, again, the system is such a way that the people who own medical facilities, the only way they can get their payment from you is through, first of all, you paying or giving them a promise or having maybe some cash deposit to take care of your bill, the hospital bill. Otherwise, in the end, also, if it's a private hospital that is a for-profit, means they have recurrent expenditure, they are not able to run their services without having to make sure that the people they treat or attend to are paying. So in the US, and this is profound, I mean, like a very good observation is in the US, the first thing they do is just treat you. When you go to a medical hospital, you're sick either by walking in or you are taken there by the EMS ambulances. you are first of all treated. They want to know what type of insurance that you have, but still, I've seen that there are resources around people who are not able to pay. Like they have like the hospital that is treating you. They have most of the hospitals have foundations, or they even have government programs that help people who have who don't have income. So what I've observed here in terms of like testing and lab works is the testing is so profound. Like it's done instantly. I can honestly say that when a patient, when a doctor requests for a specific diagnostic test, it's done almost instantly. In maybe different cases where maybe the patient is in a nursing home, they have to send lab works to the agency that it does lab for them. That's what sometimes I think takes time, but it doesn't take as much time as our situation in Kenya. So in Kenya, it's a sad situation. It's a complicated, sad situation, by the way. For example, um, last month, and this is just direct, like I was directly involved in this. My brother got involved in an accident towards the end of last month, and unfortunately, during the accident, two lives were lost. So they were rushed to a hospital. I think they were taken to a hospital from the scene of the accident. It was like 50 miles for sure to get to the hospital. And in an area that has 1 million people, a hospital, level 5, level 6 actually, it's a teaching and referral hospital. A teaching and referral hospital within an area radius serves people like an area radius of 100 miles radius. The hospital MRI doesn't work. It took more than 24 hours for my brother to get an MRI of his spine. It took more than 24 hours for us to get my brother get MRI done after a road traffic accident that costed lives. Two people died. His friends died. It took them. One of the friends died few days later. I think probably because the hospital he was admitted in, maybe they didn't do the scans. Maybe they didn't know the acuity of his situation. He died some days later. I don't know how he died or whatever killed him, but it's really sad that you cannot get an MRI or a diagnostic test done when you have, like, you're involved in an accident. That's a level 6 teaching and referral hospital. Actually, after the 24 hours, he was able to get an MRI done in one of the private hospitals called some hospital in Kisii town. And the MRI was done. And then again, some of the doctors who were seeing him, they were already like having plans of doing surgery on him. I think it was his spine. And they were hurriedly trying to get him to theater for the operation. And I don't know how it was like planned and who reviewed the MRI results, but all that said and done, I mean, like, we can't. 2026, we have a hospital, a county hospital that is serving more than 1 million people. They don't have a functional MRI. At a glance, people are involved in an accident and they don't have an MRI. So when I look at the situation in the US, for example, some of the patients I usually take care of in the hospital, a doctor requests an MRI for whichever part of the body that is supposed to be done MRI. The test is done almost immediately, almost instantly. The patient is picked up Immediately I see most of the patients I take care of, they request MRI, whatever scan, CT scan, maybe draw lab works. These investigations or tests are done instantly. To me, that's like magic. Because when, for example, let's look at the biggest hospital in Kenya, which is Kenyatta National Hospital. One of the hospital I love so much because they they serve a lot of people. They serve a population. Actually, they serve people even from outside East Africa. One of the best of the best. They have very good consultants. They have very good nurses. They have good specialists. They have good facilities. Also, with them, I don't know, but I think they also have the same problem. It takes them time. It takes you time. The turnaround time for you to get a diagnostic test done, you can be sure it will take you longer than you think. It can never be done immediately unless within the upper hill area you just go to a private facilities like German doctors. They can do CT scan immediately, they can do MRI immediately, but you have to pay. You have to pay in cash or you have to have insurance. And then remember, we're talking about 95% of people who mostly don't have jobs. Like, for example, um, most of the people, actually, when you look at the number of people who have insurance policies, medical insurance policies for their healthcare, the uptake levels in Kenya is so low. There are not many people who have insurance companies, who have insurance policies. Sorry, it takes you time. It takes you a long time. I remember one of my friends, the sister who lived in the UK that time, she traveled to Kenya and she was involved in an accident on Mombasa Road. And she was rushed to, I think it was, I don't know who picked them up from the accident scene. She was taken to Nairobi Hospital, where she stayed for a significant long time. She already had she was in critical condition. The hospital was requesting for a deposit of, I think it was 200,000 then. They were not able to get it because actually I think she was alone at night. She was with somebody else and they were both injured in the accident. So by the time they're getting to Nairobi Hospital, Nairobi West Hospital, private hospital, nobody knew them. So the hospital, they're in limbo. They're not able to proceed with care because they don't know who is going to pay. They stayed at Nairobi West Hospital for some time, and then they were transferred to Kenyatta Hospital, of course, public hospital, where they apparently can now get help because it's government hospital and government facilities. Of course, you cannot be turned away because it's a public hospital. There's nothing you can do. You have to be admitted. So by the time she was transferred to Kenyatta Hospital, by the time she was getting to Kenyatta Hospital, she was already dead. There's so many cases. Having worked in the hospital, in the hospitals in Kenya, I saw those cases all the time. Maybe things have changed, but it happens all the time. Even very prominent people have died in situations that they otherwise could have received help. So when I am talking about what I'm seeing right now, working in the US healthcare, I know it is super expensive. Like, you really have to have good insurance for you to get treated. You have to have a lot of money, especially if you have a condition that needs that you go to the hospital. It will deplete your resources. But the kind of care that is given in the US is actually paramount. It's so good, and they're doing really a good job. It's a good experience, and I can attest that there is a lot of order and organization and access. People, I think, to me, the general observation I can make is that people are over tested, or the diagnostic tests are overdone. Like, for example, in the hospital, when you're working a night shift or day shift, whatever time, when you have to draw labs, patients labs are drawn every day. Every single day you draw labs from patients. You draw labs if it's lab works and other like test CBC, BNP, they're done every single day. I don't know. I know most of the hospitals in Kenya, and I'm not trying to compare to maybe point fingers at anything or anybody. It's what it is. It's what it is. I don't know. Maybe we can do better, but there has to be deliberate intention to at least get better. I think most part, maybe the aspect of access in Kenya, one of the solutions that I really think is going to make a big difference is, of course, the economic status. If we have people who start companies, start businesses that are able to employ people so that people can have income, so that they can pay their own, they can seek their own private insurance. They can also maybe pay different good plans for SHA, for example. I think that's will be a good spot to start with. Have the government establish an environment that is going to help companies thrive, an environment that is going to help people to start businesses, to absorb and employ people, create employment for people so that at least people can have income. When we talk about creation of jobs, in this case, it's a whole different ballgame. But, like the US, where there are more jobs than the people, you see, most of the people have insurance. The uptake for insurance policies, medical insurance policies, is so high. People are prioritizing their healthcare. They're working to do like annual general medical exam. And that goes a long way to make sure that the conditions are diagnosed early and early intervention is done. And hence, maybe treatment plans and modalities are done in good time before the conditions worsen. Like, for example, if it's progressive, maybe diseases like cancer, then when it's diagnosed early, it means the intervention is done early, and even the outcomes of treatment are even better. So, man, it's what it is. What can we pick, or what can we learn from this situation is that we can do better. We can have resources around. For example, what hurts me most is the insurance, the diagnostic testing, because that's the bottom line of trying to find exactly what is ailing people before they can get treatment. One of my friends was diagnosed with, I think it was appendectomy or some pancreatic issue. He needed a surgery. That's a couple of years ago. And I remember this guy really didn't get like immediate testing, despite the condition needing urgent surgery. It took a lot of, I think it took over 3 months before he could get the surgery, which is really a sad state of affairs. But, like, for example, the best of the best hospital in one of the best counties in Kenya, the place where I was born, MRI machine in a teaching referral hospital is not working. I'm not talking about 2015 or 2010. I'm talking about 2025, December. That's less than a month ago. The MRI they said it was faulty. There was a problem. It's always faulty, by the way. Most of the time, it's faulty. It doesn't work. So if it's an MRI that is not working at a level 6 hospital, teaching and referral hospital, the county can mobilize resources to even airlift a technician from anywhere in the world to come and at least get that thing repaired so that it can get back to do what it's supposed to do. But it's what it is. I hope we are gonna do better. I hope we are going to, like, maybe establish, maybe I should just we should just start maybe putting money together so that we can maybe establish these diagnostic centers, so that at least we can even maybe charge half price, so that at least people have access, so that people can fight for their lives. People can at least maybe get help, But you know what? These are good experiences. Of course, when you find somebody who is already better than you learn from them, you try to improve. I know that hope is not lost. All is not lost. We have hope because such kind of conversations that we are sharing, we hope that this is going to help, and maybe personally taking action from my end to see maybe we can get this kind of diagnostic centers going. Thank you so much. Remember, this is Richard Ogachi. This is my channel, my YouTube channel. I channel and share this. Anybody is going to benefit, and just being out here doing what I have to do and having to say what I want to say. I hope this is going to motivate and maybe give you some insights, at least get some value and get you going. Thank you so much for listening. Thank you for subscribing to my channel. And we are in this together. Thank you so much, and see you tomorrow for sure.